Before being a trainee surgical care practitioner, I worked in the ear, nose and throat department as an operating department practitioner for about 2 years. Also, the surgical care practitioner's role offered more diversity. So we work in theatre, harvesting the leg veins from patients, coronary artery bypass, first assist with valve surgery, but we also get to see patients in clinic as well before they come in for their surgeries to provide them the information. And then we do the post-op side of things as well, where we follow up the wounds.
About a year ago I decided to bite the bullet, and I thought now's the time. I felt confident and able to sort of move forward in the role. Well, it's a 3 years master's programme that I'm doing at the moment, coming to the end of the first year. It's been great in the fact that we've had block sessions within the university, having teaching sessions and going over subjects, for example, basic anatomy, that type of thing, and perhaps covering areas that we wouldn't normally cover within our own area. It's been great meeting other trainee SCPs from all over the country that are in different fields of their, in their roles. So you've got orthopaedics and gynae and everything. So the knowledge and the sharing of ideas and everything has been great. The course is hard work. There's a lot of competencies and assignments to do, but it's all for a purpose. It gives you that knowledge that you need.
One of our competencies and assignments was to do an audit at university through the university programme, and I chose to do mine on an audit of our heart revascularisation meeting to try and improve the process. I was also lucky enough to present my audit and findings to a national conference, or the SCTS conference, which is something that I would definitely recommend anyone to do if they get the opportunity as part of their training.
The first week we did a basic surgical skills course, which was run by the college, and that was a couple of days of practical techniques, doing surgical incisions and suturing, and it was a great basis to build upon. So like knot throwing, I'd never done that before, so you realise how dexterous you are or not with that perspective, and it was excellent because you learnt the basics that you needed and you got assessed at the end of it. So a little bit of pressure to put you under, which was good because it made you really, you knew you had to do it to to pass it, and then you use those skills in the workplace when you first come in, so you didn't feel like a complete idiot.
So I was first introduced with surgical care practitioners during my SHO year as a core surgical trainee in Bristol Royal Infirmary. And the surgical care practitioners were the first people to sort of teach me those basic skills of tissue handling, how to handle with the vein when you're sort of doing a long saphenous vein harvest, how to do your surgical knots and practicing those and making sure that your ties are accurate and correct. And then also up to the whole length of that procedure, they've basically trained me through to be able to do that procedure. And now I'm competent enough to be able to return some of those favours to some of the junior surgical care practitioners which are coming through. Now I'm a trainee in Derriford. That's evolved into them being part of the surgical team. I relay and talk with them throughout the case about how they're getting on with the vein, which allows me to concentrate on what I'm doing at the top end. It also has meant that when I'm working with a consultant or a more senior registrar, I've been able to have the freedom to move between those two places to pick up what I need from each of those operations. So it's given me much more freedom to do what I need to do to develop the skills. It's also taught me some of those skills, and in return I'm now getting to the stage where I can start teaching some of those back to the junior trainees that are coming through.
Having the SCPs integrated with the pre-assessment care pathway has been really important in terms of identifying patients who are at high risk from an anaesthetic perspective, and from my point of view that's really useful because they're able to give me insights into patients who are coming through the system who I would need to see preoperatively, and to make a management plan based on either seeing the patient myself prior to surgery or seeing them on the day of surgery, and being able to make that decision based on what they tell me. Just looking at it from a kind of general patient journey point of view, I think the continuity of care aspect of things is quite important. And from what I can see from the surgical care practitioners, they are a relatively constant point of contact for a lot of the patients. And it's very common that you go and talk to a patient and they will talk about who the surgical care practitioner that they saw in their pre-operative assessment. They'll talk about the surgical care practitioner that they saw again when they came in for their repeat bloods. And there's clearly that kind of continuity of care of patients across the board with all the surgical care practitioners who are involved in the pre-assessment. I think it's important that you have a benchmark that the surgical care practitioners are taught to a certain standard, and that gives the trust confidence that as we move forward in this new era of allied health professionals taking on these enhanced roles, that you've got a standard of care that is being delivered by them. And I think the Royal College of Surgeons accreditation really kind of stamps that as a seal of quality in training.
So we were part of the first cohort at Plymouth University in 2009. So we were the guinea pigs as such. The role itself has changed over the last 10 years. From when I started and you were just based in theatre taking vein, that has transformed quite a lot actually, and we do a much broader sort of scope of practice, and I think the course has changed with that as well to actually reflect that our roles are not just theatre based anymore. Because we are a permanent member of the surgical team, we are quite often, as I say, highlighted as a pivotal point to introduce any changes in practice, which has been quite rewarding.
So when I joined in the hospital, the surgical care practitioner program was already up and running. Over the time, as a trainee and now as a consultant, I find that there's obviously there's a space for them in the workforce, which enables good contact with the patient. The role itself has evolved from just being in the operating room to a much bigger one. And I think for the patients, for sure, they benefit a lot from having one person to contact, port of call in the hospital, because it can get quite busy meeting different members of the team. We already know that they perform good quality surgical vein harvesting, they perform good quality radial harvesting. In some centres perhaps they also do sternotomy and closures, and in the thoracic surgery side of things they help in VATS lobectomies, and so it all depends on what skill mix they want to have and what they want to progress with. I think there's no boundary set, and I think within the remits of the governing body, the roles can be expanded.
So I think the Royal College of Surgeons are a good establishment to be associated with, because if I was to change hospitals doing a similar role, that would be something that's desirable for them to look for, but also it allows me to go on CPD courses and maintain my current practice as well, working alongside other professionals that are associated with the Royal College of Surgeons.